welcome to the second session at the Parliamentary Pavilion. My name is Malini Mehra. I'm your host, Chief Executive of Globe Legislators, and delighted to be joined by two colleagues, Parvana Balayeva, who is a Member of Parliament here in Azerbaijan, and by Dr. Robin Fears from the Inter-Academy Partnership. Robin is a director with the IAP, which brings together the world's national science academies together. And Robin is joining us from England, very early in the morning for you. Thank you, Robin. And we're going to be discussing now, we were discussing just in the previous session, health, education and climate change, because of course today is the day that focuses on education, health, human development. And in this particular session, we're going to be focused on climate change, health, and the legislative frameworks, with a view to how we can protect better vulnerable groups. So what we've asked Robin to do is to provide us with a landscape of the intersection between climate change and health. Of course, we have far more information now, in particular in the context of the emphasis on air pollution, but also extreme heat. So we are now much better aware of the kind of impacts which are accelerating and acting at scale. Robin's going to introduce us to some of the projects which are supporting health workers, those in the workforce who need the training, who need the sensitization. So we'll begin with that, and then I'd like to come to you, Parvana, for an illustration of what this is all meaning for Azerbaijan, the host country. I know from a number of recent presentations here in Azerbaijan, and during the course of the year, the emphasis that there has been on addressing the health impacts, in particular on children in this country. And so I'm looking forward to your insights being shared on the panel on that. But we'll begin with Robin. Robin, are you ready? I believe you've got some slides to share with us. Yes?
Yes, I'm ready. Thank you very much.
That's great. Thank you. So in that case, once again, we're just going to move to the front so that we can see. And please do put them in presentation mode.
Okay, sorry, yes. Okay. From the beginning. Okay, so you see those okay?
All good.
Right, so let me just say that for those of you who were present in the previous session, a couple of my slides may look familiar, but I will try and draw some different points relating specifically to health, science, and the importance of health and climate in policy work. As Malini just said, I will draw on work from the Inter-Academy Partnership, which is a global network of most of the world's academies of science, engineering and medicine, organized into regional academy networks in Africa, Asia, the Americas and Europe. So, and I say that because I just want to mention that in addition to providing you something of a IAP perspective, I will also mention one or two things that are happening at the regional level and at the national level in the science legislative arena. So this is IAP. This slide I also used in the last session, but I do just want to emphasize again that actually until recently, in international policy discussions such as the COPs, health had relatively little visibility as an issue for climate change. Last year in COP28 in Dubai was the first year where there was a focus on a health day, and I think the interest and the attendance of policymakers on the health issues is very welcome, but we do need now to move to understand more about the evidence basis for the adverse effects on health in children and other vulnerable groups, particularly Malini just mentioned, and what we can do about it, obviously in terms of mitigation, major focus of discussions in Azerbaijan and elsewhere, but also in terms of adaptation to the climate change effects that cannot and have not yet been mitigated. And that's what I will turn to in a minute or two. So the impacts of climate change on health are mediated through different pathways. and affected by various social determinants and the capacity of health services, very complex um, net effects on mental and physical health. One of those pathways is, as Melanie just mentioned, extreme health, extreme heat. Um, this slide is taken from a call to action by the UN Secretary General earlier this year, emphasizing that uh, across the world, extreme heat is becoming an increasing problem. Um, that may affect habitability in certain regions of the world. But even outside of those regions, extreme weather events associated with heat or other climate impacts, flooding and so on, are becoming increasingly common and can be attributed to climate change, anthropogenic climate change. So this is the background to work that IAP, the Infra Academy Partnership, has progressed and completed over the last few years to study and disclose the evidence that we have worldwide on adverse effects of climate change on health, physical and mental, and what some of the solutions might be based on our scientific understanding in the regions and including particular hotspots such as the Arctic and the Mediterranean, and indeed this region encompassing Azerbaijan. So it's a global assessment, but based very much in terms of regional evaluation of the challenges and the opportunities. And that's really my headline point, indeed in this slide, that climate change is producing unprecedented threats to our health, but there are also unprecedented scientific opportunities to address those challenges. The threats are serious and urgent. Climate change is a health crisis, and indeed the impacts are greatest in those populations who are least able to cope and actually have contributed least to generating the problems. One of the points that came up in the previous session in terms of what the legislators need to know about education, the point is emphasized that we already have a lot of knowledge that can be used, and it's essential to use that knowledge more rapidly in thinking about the solutions at the legislative level and with other stakeholders. But of course, at the same time, we need new research to fill knowledge gaps. The impacts are truly international and individual impacts, for example, pollution, cross national boundaries. Clearly, we need better monitoring and surveillance of the health effects and quantification of those effects and the potential benefits of action and the trade-offs between different policy areas and the costs of action. And my final point, which I'll come back to, is that climate change is a health crisis and it intersects other health crises and indeed intersects other global challenges, such as, for example, the loss of biodiversity. Over the last few years, academies of science at the national, regional, and global level have engaged with policymakers on a number of occasions on climate change issues and particularly climate health issues. I'll just mention a couple here. In the UK, for example, we've engaged with the Parliamentary Office of Science and Technology, that some of you may be familiar with, to inform parliamentarians about some of the emerging health issues related to climate change. At the regional level, through our Regional Academy Network, ESAC, we've engaged with the European Union official group of chief scientific advisors to inform them about the ESAC and IAP work and actually inform their own statement on climate and health. And also recently, ESAC has developed a new initiative for MEPs with a new website listed here that I commend to you as an accessible way of thinking about some of the impacts of climate, not just on health, but also on the environment and the implications for energy production and use. These are all covered in this new website. And at a global level, with IAP, we have engaged with the COP process 26, 27, and 28, and other UN bodies such as WHO and FAO to discuss the issues for climate and health, the scientific evidence, and what policymakers can do about all that. Also engaged actively with the G20 group last year, with the Indian presidency in particular, and this year. And last on this slide, but by no means least, we engaged through the good auspices of Melini with Baku Climate Action Week and very valuable activities there to bring together the science and policy and other communities. So Academy is already active, not just in thinking about these policy issues, but trying to engage with policymakers around the world. And I want to close with one other recent activity that IAP has initiated together with the global NGO Save the Children. And actually that illustrates an important issue that researchers do need to engage with other stakeholders in order to identify and implement research and its outputs at the community level. So in this initiative, we brought together a number of case studies on climate change health adaptation. So now we're talking about how can we intervene, what would be effective in tackling climate change, in adapting to what cannot be mitigated. And using these case studies, how can we build recommendations of a more general nature for policymakers and implementation in practice? We looked at a number of areas relevant to climate change: energy production and use, urbanization, city planning, health systems strengthening themselves, resilience, food systems and agriculture, another sector very important in both in generating greenhouse gases and in the potential for mitigation and adaptation of the effects. We focused on vulnerable marginalized groups, such as children, and particularly in some of the low and middle income countries, and our case studies were drawn from the countries listed here. These outputs have now been published by IAP, both in terms of the individual case studies and the lessons for policymakers. And I don't have time to go into detail, but here are just one or two of the conclusions that we highlighted for policymakers from the work with regard to the particular issues for climate, health, and science. We emphasize the need to take a transdisciplinary approach using systems-based thinking to integrate across disciplines and sectors. This is important not just for research, but also for policy making. There is a need in many countries and regions to integrate policy across the different departments. For example, health, environment, and food, agriculture. Too often, these departments act in isolation. We need a joined up policy, just as we need joined up science. We need to do more to use standardized metrics to quantify endpoints. This is particularly difficult, for example, in health adaptation, where there may be a variety of metrics that could be used, but no single endpoint, unlike efforts of mitigation, where we have the single endpoint to reduce greenhouse gases. There is no exact equivalent in health adaptation. So that requires a significant amount of discussion, not just within the research community, but with the affected communities and indeed with policymakers to ensure that the research endpoints that are used are acceptable and understandable by policymakers, such that the research can be taken up by the policy world and other stakeholders. As I mentioned, it's essential we feel to co-produce adaptation or any other solutions with end users. This is not researchers coming in and imposing their views on what needs to be done and how it should be done. We work to co-design the research and to co-design the use of that research, particularly in vulnerable groups, and on the basis of those case studies to identify generalizable lessons for, of good practice for sharing between research, for sharing between countries, for upscaling from the case study to larger interventions. And finally, a point I mentioned, climate change is a health crisis, but it does intersect with other health crises. When we were doing a lot of this work in IAP, we all lived, of course, through the COVID uh, COVID-19 pandemic, and that pandemic intersected it in various ways with the challenges of climate change. So it was necessary to look at the broader picture, both in policy terms and in terms of the research evidence. And I will finish. It's a very brief overview, and of course, we'd be delighted to discuss further to emphasize the continuing health responsibilities and other responsibilities and roles of the scientific community in taking concrete action for policy and practice. So, to reiterate, we do need to use the evidence base that's already available to inform policy with greater urgency. We cannot wait until we fill all of the knowledge gaps. We need greater ambition, need greater equity and greater integration between countries, sectors and levels of governance. So in policy terms, that includes global, regional, national and local. In addition, yes, we need to fill knowledge gaps, and that includes gaps in attribution. How sure can we be that a particular adverse health effect is associated with a particular climate change effect? We are becoming more confident in that attribution, but there's much more to be done. And we also very much need to reform the current bias in designing, generating, using research. Currently, still the preserve mainly of countries in Western Europe, the Americas and part of Asia. We need to design, implement and use research in large parts of Africa and Asia that are currently underserved. And in doing that, focus on vulnerable groups. And two final points listed here. In the health sector, health professionals themselves have a responsibility to be champions of change and to counter misinformation and policy issues for that, but also to ensure that the health sector itself takes its responsibility to decarbonize where that is possible. And that includes, of course, supply chains as well as health services themselves. So to contribute to the mitigation in the health sector. And finally, on this slide, academies have a responsibility to continue catalyzing action at the different levels in support of capacity building, research, and innovation. And that includes engagement with policymakers in the way that I briefly described previously. One other point that's not on this slide, but I noticed later in the program for you today, you have a focus on loss and damage. Well, over the last few years, scientific evidence has been increasingly used to support initiatives in mitigation and adaptation. And I would suggest to you that there is also a significant role now for scientific evidence, particularly in the health sector, to support initiatives at loss and damage. That is, the discussion of loss and damage is not just about how we can fund those initiatives, important though that is, but how we can identify the use of that loss and damage funding. in support of vulnerable communities, and that requires scientific evidence in the countries affected and supported by a worldwide scientific community. So I'll leave you with that point, if I may, and thank you very much for your attention.
Thank you very much, Robin. That is a very rich background for us to begin our conversations. Thank you for sharing and explaining the work that the Inter-Academy Partnership has been doing, the resources that you have, and I'm sure that Azerbaijan is one of those countries which is covered in those the analysis that you had presented of particular regions in terms of the impact of climate change on health. So I'd now like to turn to a Member of Parliament, Parvana Varieva. Parvana, you are a new Member of Parliament and your background is in NGOs. You understand this sector very well. So if you can provide us with an overview of the challenges that are facing this country, and in particular, because you are now a new Member of Parliament, the role that parliaments can play in addressing the challenge of climate impacts on health, which of course is, Robin has emphasized, intersecting with a number of other challenges. Over to you, please.
Thank you very much. And also I would like to thank to Robin for the comprehensive presentation about climate change impact on health, our health. Yes, climate change not only affect to environment, but also to health and health systems. IPCC, Intergovernmental Panel on Climate Change, emphasized that to limit global warming to 1.5 degrees Celsius can save millions of lives. However, minor temperature increase can cause severe catastrophic health consequences for our well-being. Climate change already impacting our health, leading to deaths and illnesses from severe weather conditions, storms and floods, extreme heat waves in Latin America, in global south, and it affects to increases vector-borne diseases, cardiovascular diseases, mental health issues, change in profiles of pathogens, and scale up of antimicrobial resistance and so on, and also it affects to increase spread of vectors like mosquitoes and ticks, which also create dengue fever, Lyme diseases, malaria, and also Zika virus. So it is very important here to analyze and understand the scale of and consequences of these health issues, health challenges in one, for example, areas. These climate-sensitive diseases are impacted disproportionately by vulnerable groups, vulnerable people with disabilities, disadvantages, women and children, migrants, then refugees, IDPs, and etc. For example, people living with HIV, they are also vulnerable group of people. So it is very important here to be ready for such health catastrophes, to be ready to make sure that we have enough health workforce. We have enough laboratories, hospitals, hospital beds, because we are here talking about finance at COP29, and it is equally important to finance health systems as well in the world. In global south, many countries suffer from without health systems, without any, for example, drugs, life-saving drugs. And as parliamentarians, what we can do, we have a unique opportunity to propose laws, legislation, innovative, people-centered health services, solutions to our laws, our legislation. Then we have opportunity to also advocate to increase health budgets in national level. To increase, for example, budget for technology, for AI, because we are living in the 21st century, and technology develops day by day. So we can also apply artificial intelligence to health systems. In the health systems, we see here in one pavilion portable X-ray devices that weigh only 3.5 kilograms. So it is very easy to carry out them, and they also give the results. The AI gives the results, so you don't need any radiologists, any technicians can do it in remote areas, in the areas where there is no any doctors, there is no any health facilities. So AI technology is very important. And as parliamentarians, we can also strengthen our efforts at an international level. For example, the countries make any commitments, sign declarations, health declarations, but it is equally important to integrate global pledges, global commitments into national level. We should include these goals to our national health strategies and to implement countrywide.
Parvana, you understand these issues extremely well. You know what the challenge is and what the opportunities are. I mean, as Robin pointed out, this is an unprecedented global threat, but it is an unprecedented opportunity also. Robin, you emphasize scientific cooperation, but Parvana, your superpower is that you are a member of parliament. So looking at the next step, so COP29 has provided a real impetus for the country to put climate change impacts and opportunities on the agenda. So given what you know about the health system in Azerbaijan, what would be the first 1, 2, 3 things that you would propose for a dialogue in the right committee, in the Milli Majlis?
Actually, I see there is a gap to financing health studies. We need to increase our budget to support R&D, research and development in health. Because it is very important actually to have data, evidence-based data in the end. For example, in my country, there are some specific regions that climate change impact to health as well. For example, we observe that when we see the health data for 10 years or more than 10 years, we see that in one place, the increase in cardiovascular diseases we observe. So there will be a linkage between environment, extreme heat waves, for example, with cardiovascular disease increase. So it would be good to have plenty of health studies in this point. To analyze and understand the scale-up and consequences of extreme heat waves or floodings in one region. We can choose pilot region, pilot area, and to analyze and to understand if climate change impacted on our health and which diseases scaled up, which disease burden scaled up in specific areas. And also Azerbaijan have its own SDGs, Azerbaijan 2030 National Priorities for Social and Economic Development. We have here 2 priority areas that that targeted to improve healthy lifestyles of citizens and green growth and clean air and clean water and sanitation for our residents. And some ministries implement these priorities, these goals. And also Azerbaijan take new commitment to be co-convener of ATACH. Maybe you know about it. It is Alliance for Transformative Action for Climate and Health, ATACH. And this we will chair this alliance, co-chair this alliance for 2 years, 2024 and 2026. And Azerbaijan also invites all stakeholders to join these efforts for climate resilience future as well as for low carbon sustainable health systems in the world. Also, today is Health Day within COP29, together with education and children and youth. And there are plenty of meetings here, side events and high-level meetings about health. And third, global oral health climate change climate change conference starts today. Our minister also will be here. So it is very important to take global commitments in strengthening health systems as well.
You're absolutely right. And these conversations are taking place in many different fora. There are the alliances like Attach that you've just mentioned. Parliamentarians will have a role to make sure that once the COP circus has moved away, that you will be having hearings. So if you can shed some light on what the committee structures are like in the national parliament, and whether any adjustment would need to be made so that these conversations can be taken forward with the right structure in place, and with a view to looking at the intersections between the different dialogues. I'll give you one example. There is a need for an alignment between your national health strategy and the national energy strategy. So if we look at issues like air pollution, where they are related to environmental pollutants, that there has to be a joint work program between the relevant ministries, yeah? So whether those kind of alignments are possible given the current structures in place, or whether you foresee some changes, some innovations as a result of the participation in the COP29 process?
Actually, one of COP29 14 initiatives. There is one initiative investing in healthcare services because it is very important to also financing health systems to strengthen them to be ready for the next pandemics. Because as we all already remember that nobody in the world and not a country was ready for such kind of such a huge virus that mutated continuously and quickly spread from each others. So it is very important also to allow some funding to pandemic preparedness, response and prevention. As Health Committee in our Parliament, we are also closely collaborate with the State Agency on Mandatory Health Insurance, as well as Minister of Health, because every time we observe that there is gap in provision of people-centered healthcare services for people, affordable, qualified services. For example, recently we made some amendments to our medical insurance law. We included provision of drugs, medicines during ambulatory medical care. We had this provision in hospital treatment, but it was not available actually for ambulatory treatment. So it is now available, mainly preventive and prophylactic medicines, drugs are provided for patients, but if the medical insurance budget can be increased in the following years, so they can also provide drugs for other illnesses. The main purpose of these provisions, of course, to tackle with I would say to prevent, to early diagnose diseases, early stage diagnose these diseases and save more lives.
Thank you very much. Let me bring in Robin now, because Robin, you paid a lot of attention to the role of the scientific community and the potential for partnership. I know that your national member is the Azerbaijan National Academy of Science, ANAS. So that's an institution that could play a key role here. From what you know about their agenda, where is the opportunity for alignment on generating the research and development that then leads to the kind of data provision that fills the data gap that Parvana is talking about? Where do you see those opportunities, so that as a result of this conversation, we can then take it forward and see what the potential would be for collaboration between the different scientific institutes and the policymakers and the legislators?
Yes, thank you. That's a very good point. And you've mentioned previously the important initiatives in Azerbaijan to bring together network of universities to collectively build a critical mass to understand and tackle climate change. And I agree with you. I emphasize that the Academy of Science in Azerbaijan can be in my view, can be a critical partner to such academic networks. So obviously, there's a lot of overlap in terms of scientific interest and expertise. In terms of COP29, I know that the Academy has been active in the run-up to COP29, and I'm sure it is equally active during these couple of weeks. They indeed recognise the importance of climate change across the sectors in health, but indeed in the other sectors, and I think are very willing to be participants in discussions and partnerships as they go forward. I would just add, I think that one point that I discussed with the Academy when I was here last month is which you have already touched upon, is the importance of regional activity. In terms of defining this region, I don't know, let's call it the Caspian Sea neighborhood, of countries working together through their academic institutions, through their academies on joint challenges. And obviously the Caspian Sea itself is a joint challenge in terms of climate change. So to continue building that critical mass at the regional level, which actually has been underrepresented in geographical terms compared to some of the other areas that we know about for climate and health, just as there's a current focus on the Mediterranean and the Eastern Mediterranean and the Middle East in terms of being a climate change hotspot in various respects. So I think that there's an important work to be done in the Caspian Sea neighborhood as part of that global focus.
Indeed. So let's pick that up, because I know that there is transboundary cooperation on the water agenda from a research point of view. And as Robin mentions, there is a gap in the market, so to speak, for research collaboration on the health agenda. So what do you see the scope for accelerating that cooperation from where you're sitting, Parvana, on health in particular?
Actually, it would be a good opportunity and initiative to propose such kind of health research to also involve Caspian Sea regional countries, health researchers, and to analyze environmental data for 10 years or for 15 years, and also health data, comparing them with any desk reviews, with any, for example, interviews with patients and family members of patients, so to understand if these kind of environmental damage have specific impact on these health-related issues or not. Because when we search about such kind of studies that is operated in Azerbaijan, in the country, there is not any specific. About, for example, Caspian Sea level has dramatically dropped even a meter, more than a meter in just a few years. But in some places, people say that it is not dropped, but the level of sea increased. So I think that there is a science gap here. People living in the basins of Caspian Sea should be interviewed to get their opinions, thoughts, not only young people, but mainly elderly, because they have huge experience, deep experience with living in the Caspian Sea basins, and they, with their eyes, observe if it is dropped or the level increased, or if it has any impact to our health, if it increased public health issues, vector-borne diseases or cardiovascular diseases in certain areas or not. So there is a science gap here.
That's great. So there's real scope for that
And
specifically.
we are ready, of course, to collaborate with Mr. Robin in this issue.
So that's great. So there's an offer and there's an invitation. So Robin, you have national academies of sciences in every country in the region, and this is a relatively uncontroversial issue to be partnering on. So let's pursue that and let's see how far we can come. Say by the time of the review process next year, let's see if we can make this part of the process of building those scientific research collaborations that address a critical issue for all of the members of the Caspian region.
Yeah, we need definitely statistics and evidence-based data should be generated to be on the ground, to also for advocacy, advocating that we have enough data, we can advocate with data on international platforms and say that we actually need some support, some any kind of financing, funding to strengthening also our climate change related health issues.
Fantastic. So I think we have a making of a collaboration here. So we'll go away and think about that. But in the last few minutes, I'd like to open it up to a discussion, see if there's any question or comments for Robin or for Parvana from those in the audience here. So we can't pick them up from those who are following the live stream, but this recording will be available later. So any thoughts, comments? And if people are too shy right now, I'm going to give the final word, please, to Parvana, and just help us bring this to a close.
Okay. Climate change is a health threat. And health is human rights. It's not a luxury, not a privilege, but it is fundamental human rights. So it is very important, together with climate change, also highlight the devastating impact of climate change to health in specific areas, and to highlight the needs and challenges the global south face regarding health issues. Thank you.
Very well put. So thank you very much. And on that note, I'd like to bring this session to a close and thank our fantastic speakers, Parvana Valieva, Member of Parliament.
Thank you for the invitation.
From Azerbaijan, and Dr. Robin Fears, who's a director with the Inter Academy Partnership, joining us from the UK. Thank you both.